Independence is important to all of us. We don't want to have to rely on other people to help us do things. We prefer to do things for ourselves, from cooking, to buying groceries, to driving our car. And of course, no one wants to give up the activities they enjoy. Golf, swimming, bowling, gardening, or just playing with our children or grandchildren. Moving around with little or no pain is essential to our independence. But there are times when even the simplest of tasks, like getting out of a chair or car, become too painful. And that's when we may begin to lose our enthusiasm for independence and an active lifestyle. The good news is that you don't have to live with hip pain. It's a problem that can be controlled. You and your orthopedic surgeon can consider a number of treatment options, including hip replacement. It's perfectly normal to have some apprehension about having hip replacement surgery. But this surgery has become a very common procedure, and patient satisfaction is very high. Over the past 50 years, hip replacement surgery has helped hundreds of thousands of people ease their pain and get back to a more normal, active lifestyle. Still, the decision to have the surgery requires a clear understanding of the entire therapy. In this program, you'll learn about getting ready for surgery, about what happens on the day of your surgery, and about the importance of rehabilitation after the surgery. The goal is to help you decide about hip replacement surgery, to feel more comfortable with your decision, and to help you resume your normal daily activities after surgery.
Hello, I'm Dr. Rob Riley, your host for this patient guide to hip replacement. Hip replacement surgery is an important step to regaining freedom and independence in your life. I'll be addressing the points that I believe will help you become more comfortable with hip replacement surgery as a treatment option. After watching this program, you'll be in a better position to make an informed decision about your health care. Let's start with a history of joint surgery, and then we'll talk about how your hip works and what can cause the pain that you've been experiencing. Surgeons first began using metal implants to treat damaged hips in the 1930s, replacing the joint surface of just one bone, either the pelvis or the thigh bone. In the 1960s, Sir John Charnley began replacing the joint surfaces of both bones simultaneously. This led the way for today's modern hip replacement therapy. Through the years, improvements have been made in the design of artificial joints, as well as in the surgical techniques used to implant them. The materials now used are more durable and biocompatible, and they appear to last longer. Although how long an implant lasts varies and depends on many factors. New surgical techniques and recovery therapies also make hip replacement highly successful. Now let's take a look at the hip joint. The normal, healthy hip enables us to stand, walk, run, jump, climb and descend stairs, squat, and perform many other daily activities without difficulty or pain. Your hip is a simple ball and socket joint where your thigh bone joins with your pelvis. Surrounded by cartilage, muscles, and tendons, your hip is one of the largest weight-bearing joints. The tendons attach muscles to the bones, enabling movement of the hip and leg. The joint capsule connects the ball and socket. In a normal, healthy hip, the surfaces of the ball and socket where they rub together are very smooth and covered with a tough, spongy protective tissue called articular cartilage. The cartilage absorbs stress and prevents direct contact between the bones, so the ball moves easily in the socket without creating friction or wear on the bone surfaces. But when arthritis attacks the hip joint, damage to the articular cartilage and bone begins. Although fractures or loss of blood supply to the ball of your hip may require hip replacement surgery, most hip replacements are due to arthritis. Arthritis is an inflammation of the joint. The most common form of arthritis is degenerative or osteoarthritis, which can affect both men and women as they get older. Another kind of arthritis, rheumatoid arthritis, is more common in women than in men. Arthritis creates a condition in the joint that damages the articular cartilage and bone, causing stiffness and pain. Without a layer of healthy cartilage, the bones rub together as the ball moves inside the socket. Damage to the hip usually takes place over several years. As the articular cartilage begins to wear away, inflammation occurs. As the deterioration progresses, the bones that make up the ball and socket begin to grind together. This may eventually cause severe stiffness and pain, and hip replacement may be necessary. Before discussing the details of hip replacement surgery, I'd like to mention a few key points. Although widely practiced, hip replacement is a major surgical procedure and should only be considered when all other treatment options have failed or been ruled out. Even though there is a high success rate with hip replacements, there are no guarantees that you'll be able to do all of the things you want to. You and your doctor should first consider more conservative treatments like weight loss, exercise, physical therapy, over-the-counter medications, prescription anti-inflammatory medications, or injection therapy, which includes steroids like cortisone. Your doctor can discuss these options in detail if a less invasive approach has not been tried. If surgery is recommended, it's a decision that should be made with the advice of your doctor and loved ones. But making the decision to have hip replacement surgery is only part of your commitment. It's very important also that you be committed to your physical therapy and exercise program after your surgery. Proper rehabilitation is vital to the healing process and to the long-term success of your surgery.
This is a decision you should not make alone. It's important that you seek information about the surgery and recovery. Visit with your doctor and feel free to discuss all your concerns. Watch all of this video and discuss it with your family. It should help you come to a decision that's right for you. Remember, you're not alone. All patients who have hip replacement surgery go through a similar process. The program will now focus on what usually happens before, during, and after your surgery, and your role in getting the most from your post-operative rehabilitation.
Well, Barb and John, now that we've been through all of the various treatment options and you're still having trouble, I think it's time for us to talk about hip replacement surgery. So, what questions can I answer for you today?
Well, first, can you tell me the risks of this surgery?
Well, that's a really good question. All surgeries have the potential for risks and complications. With hip replacement surgery, there are a number of things which can occur.
Although it is important to be aware of these potential risks and complications, your doctor should not recommend this procedure if it were not a good option for you. The surgical team takes many precautions to reduce and manage risks, which include possible reactions to anesthesia, the development of blood clots and infection, damage to nearby blood vessels, bones, or nerves, the possibility of dislocation of the joint, and residual pain. In the book that accompanies this program, you will learn more detail about the risks and how the surgical team and hospital staff take every precaution to avoid potential problems.
What should we do to prepare for the surgery?
Well, there are several things you should do to help prepare for the surgery.
One important thing you should do is prepare your home to make your recovery safer and easier. A family member or friend can help you arrange your home so that when you return from the hospital, everything you need is in place. For example, make sure that nothing prevents you from safely moving around in your living room, bedroom, bathroom, and kitchen. Be aware of anything on the floor, like a throw rug that may cause you to fall. Remove any furniture you could bump into or is not stable enough to support you. Install hand railings wherever you need support. Place non-slip strips in the bath or shower. You may even want to get a raised toilet seat. Have enough comfortable clothing on hand that you can get on and off easily. If there is no one to cook for you, prepare a 1-week supply of meals that can be frozen before surgery and then easily thawed and cooked during your recovery. Walk through your home and think about the things you do every day. Imagine having to do those things while using a cane or walker. This will help you prepare your home.
Is there anything else I should do?
Yes, there are a number of other things you should do to prepare.
You may be asked to quit smoking. and to complete any dental work or other medical work you've started. Your doctor may also advise you to lose weight, which may help to reduce the stress on your joint. Depending on the current condition of your hip, you may be asked to begin some type of light exercise program to help prepare you for your rehabilitation after surgery. Building upper body strength will help you when using a walker or crutches. Also, if you get into the habit of exercising now, it will be easier to perform your physical therapy and exercises that will be so important to your recovery. If the pain and stiffness in your joint permit, walking, stretching, and isometric exercises are excellent ways to lose weight and prepare for the surgery. Your doctor will determine what level of exercise is best for you. Your doctor will also explain any other pre-surgery needs, such as a physical examination by your primary care physician, reviewing your insurance and financial plans, and possibly arranging for a pre-admission visit to the hospital.
Tell me about the surgery itself.
Okay, let's begin with the day you go to the hospital for your surgery.
You may be admitted to the hospital the same day as your surgery or the night before. You'll be asked not to eat or drink anything after midnight before your surgery. After you're admitted to the hospital, preparation will begin for your surgery. You may receive an injection to help you relax. Your doctor may want blood drawn before the surgery to determine your blood count. An intravenous line will be inserted so you can receive antibiotics, pain medication, liquid nutrition, and possibly a blood transfusion during or after your surgery. Your need for a blood transfusion will be determined by your condition. The nurse will periodically check your blood pressure, temperature, pulse, and breathing sensors will be placed on your chest and hands to monitor these things during the surgery. You may also have an oxygen tube placed in your nostrils. These pre-surgical steps are standard procedures. The nursing staff will attend to you on a regular basis.
What's the major problem with my hip that requires this surgery?
The major problem that requires hip replacement surgery is wear or degeneration of the articular cartilage surfaces that make up the joint. This can lead to alterations in the alignment of the leg, which can cause related back or hip problems and severe pain, all of which can seriously disrupt your everyday activities. No current medications or treatment will make damaged cartilage or bone grow back. Hip replacement is reserved for individuals who have tried all other treatment options, and their pain and its impact on their lives is no longer acceptable.
Tell me about the implant itself.
Well, this is what an implant looks like. A ball replaces the worn head of your thigh bone with the stem inserted into the thigh bone for stability. Either a polyethylene cup or a metal one lined with polyethylene replaces your worn socket in the pelvis. The implants are made from a combination of various types of metal alloys and either a very hard ceramic material or very high-density medical-grade polyethylene. Significant advances have been made in the science of polyethylene, such as cross-linking, that aid in its resistance to wear. Just like a healthy hip, these implants have smooth, gliding surfaces that allow you to move easily and without pain.
So what's done during surgery?
Well, the surgery begins with an incision in the area of your hip. The surgeon will then...
The length and location of the incision will vary depending on your needs. For some patients, a less invasive approach may be used, where smaller incisions with less or no cutting of key muscles and tissues may be sufficient to replace the joint. Your hospital stay may be shorter with these procedures. Other patients may require more open exposure. Your doctor will determine what is best for you. The same high-quality implants are used for either procedure. After the joint is exposed, precision instruments are used to remove the ball from your thigh bone and to smooth the inside surface of your worn-out socket. The inside of the thigh bone is then prepared and the femoral stem is inserted. Your new cup is then fixed in place in the pelvis. After the stem is secure in the thigh bone, the ball and socket are joined. The implants are secured in place either by a special bone cement or simply by friction. Some implants have special materials that allow bone to grow into pores over time and, in essence, grab hold of the implant to help keep it in place. Your doctor will choose the method that's best for you.
So what happens after the surgery?
Well, immediately after surgery, Barb will be transferred to the recovery room.
In the recovery room, a team of nurses will monitor you closely. You will be required to keep a special pillow, called an abductor pillow, between your legs to help maintain your hip in its correct position. You will continue to use the pillow even after you leave the hospital. You may have a cold pack applied to your hip to help control bleeding, pain, and swelling at the incision site. Your leg may be covered with plastic wrapping or a compression stocking to promote circulation and reduce swelling. Your doctor may use a catheter to empty your bladder. Another tube may be used to drain excess fluids from the operative site. You may also have an IV to administer pain medication, antibiotics, and nutrients. You'll be encouraged to breathe deeply and cough to clear your lungs. Pain medications may be administered by a pump that you control as needed, or by pill or injection. When you're fully conscious and stable, usually about 1 to 3 hours after surgery, you'll be transferred to your room for further recovery until discharge. Recovery from the surgery may be somewhat painful for the first few days, particularly during your early physical therapy. But with the proper use of pain medication, the recovery process is generally quite tolerable. You may or may not be transferred to another facility for a few more days of rehabilitation, as determined by your doctor. Gentle physical therapy will start while you're in the hospital. This is done to help you get in and out of a bed and chair safely, to strengthen the muscles, and to regain your range of motion. For a less invasive procedure, your first physical therapy session may begin within 1 or 2 hours after you leave the recovery area. In this session, you may be asked to sit on the edge of your bed or to move from your bed to a chair. Then you will probably have at least one other physical therapy session before going home. In the second session, you will probably practice getting into and out of bed, standing and walking with the help of crutches, and maneuvering stairs. For a traditional procedure, on the day of surgery, you may be asked to sit on the edge of your bed and dangle your feet. Within the next 24 hours, the physical therapist will help you start walking, a few steps at a time. You can expect to start with a walker and progress to crutches. This walking or gait training helps you regain confidence, balance, and some normal walking motion before going home. The use of pain medication prior to each physical therapy session may be recommended.
So how long will I be in the hospital?
Well, that depends on the specific procedure that's done. You'll be discharged as soon as you've recovered sufficiently to go home. For most people with hip replacement surgery, that's about 3 to 4 days. But with newer techniques that are sometimes less invasive, that can be moved up to 48 hours or even sometimes to 24.
When it's time to leave the hospital, your doctor will discharge you and the nurses will help you make arrangements to go home. Your doctor will probably prescribe a pain medication for you to take as needed and an anticoagulation drug that a home care nurse may administer. Before leaving, you will be given instructions for safe home recovery. Remember, you can ask your doctor or the nurses any questions you may have.
What happens when she gets back home?
Well, at first, it'll be important to limit your activities. Having friends and family around can be very helpful to get through those first few days.
With a shorter hospital stay, your care and rehabilitation will continue at home in much the same way that it would if you were staying longer in the hospital. Don't allow your incision to get wet for the first few days after surgery. Your surgeon will tell you how long to wait. After that, it may be okay to take a shower, but your doctor may not want you to submerge the hip in a bath for about 3 weeks after surgery. And remember, it's very important that you follow the physical therapy and exercise program developed for you by your physical therapist. By doing so, you'll help ensure a relatively normal range of motion upon recovery. The following post-operative exercises are examples. Be sure to check with your doctor before doing any exercises in case they are not appropriate for your situation.
The first exercise that we're going to do today is called quad sets. What you're going to have to do is tighten your thigh muscle, pushing down into the bed here. And you hold that contraction for about 3 seconds. Push down. Good. Let's go on to the next exercise. The next exercise is going to involve your ankle more than anything else. This exercise is for keeping your circulation good, and it helps to promote healing. So you're going to bring your toes towards your body and then push down. From this exercise, you can go right into ankle circles, where you're going to move your ankle in different directions. Good. This is another one that's just good for keeping good circulation throughout the leg. All right? Now let's work on a little bit of range of motion with these exercises. Let's have you do a heel slide. This is where you're going to bend your knee, nice and slow, and back down straight onto the bed. You're not going to want to take that knee past 90 degrees at this point, but take it up to where you're feeling a good pull on your leg. This next exercise I want you to try is called a straight leg raise. You're going to be focusing in on these thigh muscles again. You're going to lock your leg straight, and I want you to raise your leg to right about my hand. Hold it, and back down. Each of these exercises should be performed around 10 times each when you're doing them, and 2 to 3 times a day. Another exercise we can do while you're laying down is the gluteal sets, where you're going to squeeze your gluteal muscles and tighten them. Good. Hold that for 3 seconds. Relax. Again. Good. These muscles are very important for when you're maneuvering around in bed or getting up and down into a standing position. Okay? The next exercise, I'll have you bend your knees up. Good. This is another good exercise called bridging, where you're going to lift your hips up off of the bed. Good. And relax them back down. This is another good exercise for maneuvering back and forth in bed, scooting from side to side and things like that. All right? Let's let your legs back down straight, and we're going to do what's called hip abduction. This is where you're going to slide your leg out to the side, back in. And once again, you can do this 10 times. Each time you do it, 2 to 3 times a day should be sufficient at this point. Remember the 3 major hip precautions. Don't flex your hip past 90 degrees, this angle. Don't rotate your toe inward like being pigeon-toed. And don't cross your legs over or move your leg past the midline of your body. Okay? Now next we're going to get the walker, and we're going to get you up out of bed. Barb, the next thing we're going to have you do, I'm going to have you sit up at the edge of the bed. Okay? Grab my hand, get your legs to the side, come to the edge, right there. Get your balance. You okay? All right, now I'm going to bring this walker in front of you. And I want you to push up off the bed with your hands. Stand up straight, nice, straight and tall. Have your balance? Good. You feel okay? You're not dizzy or anything, right? Good. All right, I'm going to have you do 2 exercises while you're standing here. The first one's called weight shifting. I want you to shift your weight over onto your right leg. There we go. Keep this tolerable. I don't want the pain to be too much. And then shift back to your left. Okay, good. The other exercise is marching. You might have to scoot your walker out just a little forward. There we go. I want you to just raise that right hip up into the air and back down. And your left. Good, good. Now if that feels too painful while you put all your weight onto that right leg, use your arms to put a little more pressure down, okay? Let's move over to the chair now, Barb. Let's move the walker forward. Step forward a little more. Shift your weight down onto your arms. Good. Scoot back towards the chair. Do you feel that at the back of your legs yet? Okay, at this point, you're going to reach back. Grab the arms of the chair. Let yourself down slowly. Scoot your foot out. Excellent. Now scoot back in the chair just a little bit. There. Comfortable there? Excellent. Now we're going to have you stand up the same way you sit back down. So you're going to scoot to the edge of the chair. Push up. Get up straight. Stand up straight. Good. Get your balance.
Yeah.
You feel good up there?
Yeah.
Have any pain with that?
No.
Nice work. Hey, you did an excellent job today. Do you have any questions that you can think about?
Physical therapy and exercise will help ensure a relatively normal range of motion during recovery.
How long will it take for a full recovery?
Well, that depends on a lot of things. As you regain strength and confidence, you'll find you'll be able to return to some of your...
Within 6 weeks after traditional hip replacement surgery, most patients are able to walk with a cane and will probably feel well enough to drive a car within 8 weeks after surgery. Patients undergoing less invasive hip replacement procedures may be able to discontinue the use of crutches by the 4th day and all walking aids by the 14th day. This depends on the specific procedure and will vary considerably from one patient to another. Also, for some less invasive procedures, most patients are able to resume driving within 2 to 6 weeks after surgery. If your right hip is replaced, you must be able to bear full weight on the new hip, and the thigh muscles must be strong enough to respond quickly when driving. If you have a sedentary job, you may be able to return to work as early as 2 to 6 weeks after surgery. For jobs that require walking, standing, or lifting, your return to work may be delayed beyond 6 weeks, but be sure to consult your doctor before resuming normal activity. Once you've recovered from surgery and completed your physical therapy, it is essential that you properly care for your new hip. This doesn't mean missing the daily activities you hoped for before the surgery. It just means you need to be careful not to injure the hip through carelessness. It is not advisable to run a marathon or play singles tennis, but most people can take walks, play golf with a cart, ride a bicycle, and swim. Proper care can mean years of easier movement and continued independence.
Congratulations! You've just completed one of the important steps to making the decision about whether to have hip replacement surgery. This program is intended to be a source of hope and help in reducing the pain you experience in your hip. But there is more you should do to become a completely informed patient. Your doctor will provide you with more detailed information about how to proceed with the surgery if you decide to go ahead. Thanks to new surgical techniques and materials, you now have the potential to move around more easily with less pain.
A patient guide to hip replacement surgery was designed to supplement this video. It provides basic information about hip replacement surgery. But the information included should not take the place of advice and guidance provided by your personal doctor or other members of your healthcare team. All of these materials are designed to help make you more comfortable with hip replacement surgery.